And welcome back. I'm Mabel. Jong, you're watching continuing coverage of the World Healthcare Congress coming to you from Washington, D.C. And a very special welcome back to our viewers who are joining us live virtually. In our studio this morning, Susan Dentzer, President and CEO of Network for Excellence in Health Innovation. We're going to get a check-in from Susan about what she experienced on the panel that she just finished. And also, we're going to talk about telemedicine. Susan, good morning.
Great to be with you, Mabel. Thanks for having me.
And what were some of the takeaways that you were able to leave with folks in the panel that just ended?
Well, one takeaway certainly is that when we use the phrase consumer engagement, that's a big umbrella topic over a lot of very different things. Motivating people who are extremely sick, have a lot of social and behavioral issues, is very, very different from helping a pretty healthy person who just has an immediate primary care need go to the right clinic or physician. Those are really different strategies, and sort of how organizations, whether it's a health plan, whether it's an employer who's worried about employees getting care that is appropriate, or whether it is a provider, obviously they're coming at it from very different perspectives. What I think we have learned, or certainly what came through on the panel, is that to the degree that a lot of organizations thought that consumer engagement meant, strictly speaking, just putting people into high deductible health plans, giving them skin in the game, and that was going to motivate the right decisions. Nobody believes that anymore as an exclusive strategy. Is it good to make people aware of costs of things? Yes. Is it good to make people aware of differences in costs and quality among providers? Absolutely yes. But your strategies for getting people to do what you want to do have to be more nuanced than just saying, you're on your own after, or the first $2,000 are up to you, and you'll make the right decisions if we just give you an HSA. Nobody believes that anymore. Right. So we've certainly heard that. We also heard that there's some real innovation going on in how people are thinking about getting information to people and motivating behavior change. Providence Health System has a scientific wellness approach that they'll be building on in future years to give people more information about their genomics and about other really pretty sophisticated things. That's important, but it's also important to know if people are coming to the ED because they're hungry. And so some combination between understanding at a really high level what information is going to be valuable to people, and then at a very basic level what people need and what's motivating their behavior. That came through loud and clear as a whole spectrum of information that organizations need to take into account as they figure out how to motivate people to do things.
Well, Susan, we certainly seem to know a lot about what people should do, but it seems very difficult to get them to actually do it. Consumer engagement, that's been out there for quite some time. And also talking about telemedicine, too. And you have a special role in this. You have a special interest in it. We know about the promise of telemedicine, but we don't seem to be really getting at it and fulfilling that promise. Why is that?
Well, we at NEHI have a project that we call Healthcare Without Walls, which is really looking very broadly, not just at telemedicine, which is obviously an important component of it, but looking at the whole notion of what if you had a healthcare system that went to people instead of people having to go to it. First of all, let's recognize that most people don't want to live their lives in the healthcare system, and don't, frankly, most of them. We live our lives out in the community or our workplaces and schools, etc. If it were up to technology alone, we know we have the capability to get a lot of care to people in those more distributed settings through avenues like telehealth. We're not doing it as much as we can. But if we put that together with our understanding that the social determinants of health are very important drivers of people's health status, issues like, are you hungry? Do you have transportation? Do you have to take a day off from work in order to go see a healthcare provider? Those things matter in people's lives. So how do we take the capabilities that we have today, move healthcare to a more distributed setting. And it turns out it's not, the rate limiting factor here is not the technology. We have all of the technologies to do it. It's other things. It's, does the payment model support the provision of care in other ways? Does regulation enable the provision of care in other ways? We have the issue already of physicians needing to be licensed in 2 different states if they're going to do telehealth across state lines.
Okay.
It's the workforce. Is the workforce able to do this? Is it trained to do this now? Is it motivated to do this? How do you deploy the workforce very differently if we're moving care out of institutional settings like hospitals and nursing homes to more distributed settings? So those issues all matter, and our project is designed to look at this ecosystem, create a vision for what healthcare could look like if it were without walls, in effect, in 2025. And how do we get there? How do we attack these various obstacles standing in the way?
In the process of looking at this, what specific measures are you helping push forward?
Well, we're drawing up a list of recommendations that we think will be critical if we're going to take this healthcare without walls and make it a reality in 2025. Number one is payment. I mean, payment models have to support the movement of care this way. Right now, as we know, a lot of hospitals are still incentivized to fill up the hospitals. We think there's a lot of potential to continue the process of emptying out hospitals. We're not going to do away with in on-site care. We're still going to want lots of trauma centers and everything else, but we already know through projects and initiatives like Hospital at Home that probably 30% of patients who are still being hospitalized could be effectively, quote, hospitalized at home. We need payment to support that movement.
What might that look like, Susan? What does NEHI think that should look like?
Well, it could take a variety of different forms. I mean, in the largest sense, obviously, capitated models enable that because an organization like Kaiser Permanente isn't motivated to fill up hospital beds, right? They're motivated to deliver the best, most cost-effective care within an envelope. But we could also think, short of capitation, bundles obviously could push in that direction, and also shared risk models. And already we see in, for example, the next generation ACO models, telehealth waivers that are enabling more provision of care. A lot of organizations think they're not going to make $1 off of the telehealth piece of it if they're in the next gen ACO, but they think that that's the way care should be provided, so they're willing to move in that direction. So as we create more incentives for organizations to do that, or more ability for them to do it within the payment model, they will do it because it's effective, and that's what people want. People want to be able to have care when they need it, where they need it, close to home if at all possible.
All right. And Susan, we're so pleased to get to see you each year. What keeps you coming back to this particular meeting?
World Healthcare Congress, let's face it, it brings together a unique bunch of people year after year after year. Some of the overall issues stay the same, of course, as they do with healthcare. We're still driving toward affordability. We're still driving toward increased access. We're still driving toward improved quality of care. But the folks who are in the trenches doing that changes from year to year, and the tools that we're bringing to bear on all of those problems change from year to year. And those people come to World Healthcare Congress. So it's always a great place to come and check in on the state of the art of all of our efforts to improve health and healthcare.
All right, Susan Dentzer, thank you so much for your time. Really appreciate it.
Great to be with you, Mabel.
And I'm Mabel Jong. Thanks so much for joining us. Stay tuned.